Welcome. As you prepare for discharge from the hospital, you probably have some questions about everything you learned and experienced while you were in the hospital and what to expect from this next phase of your recovery. I'd like to spend some time with you today reviewing some important information that will provide you with answers to some of the more common questions that patients usually have before they are discharged. Most of what I talk about will be a review of things your orthopedic surgeon, nurse, and therapist have spoken to you about already. But it is a good idea to review the information, and please, if you have any questions, speak to your orthopedic surgeon, your nurse, or your physical therapist before you are discharged from the hospital. They will be happy to answer any questions you may have. Usually, you will be discharged from the hospital once you have achieved some specific ambulation activity goals established by your orthopedic surgeon. Your health team has been reviewing these goals with you while you have been in the hospital. Generally, these goals include ability to walk 100 feet, able to independently get out of bed and a chair, able to bend your knee 90 degrees, and finally, that you are able to meet your stair climbing goals. Your ability to meet these important ambulation activity goals demonstrates that you are ready to begin the next phase of your recovery. It's an exciting time, and remember, you learned a lot while you were in the hospital, and you are ready to take this next step to getting back to the activities you did before you had joint pain. There are a few different options available to you as you leave the hospital. Whether you are discharged home with outpatient physical therapy, home with home health care, or you go to a rehabilitation center, it is important for you to continue with your exercise plan that you learned while in the hospital. Following this plan will help you achieve the maximum results from your surgery. Now, let's begin reviewing some of the key things you learned to assist you in preparing for your discharge. First, if you are going home and someone is there before you arrive, remind them to pick up any throw rugs or move any electrical cords or any other items that might cause you to trip or fall. Also, please remember to use the handrails when you go up and down stairs. When you leave the hospital, use your walker or crutches as directed by your orthopedic surgeon or physical therapist. Now, let's talk about your incision. You will leave the hospital with stitches or staples running along your wound or a suture beneath your skin. Avoid getting your wound wet until your orthopedic surgeon advises you that you can. When your orthopedic surgeon does give you the okay to shower, please have someone close by in case you need some assistance. And please don't shower if you are weak or dizzy. Usually, the sutures or staples are removed within 3 weeks after surgery. Also, you should not use creams or ointments on your incision. You may have some bruising and warmth around the incision line. This is not unusual and should not cause you to be alarmed. However, there are some signs that you should report to your surgeon immediately. The signs to look for are an increase in swelling and pain, drainage around the incision, increased redness around the incision, bright red blood draining from the incision, persistent groin or calf pain or swelling in the calf, chest pain, difficulty breathing, congestion, or a body temperature over 100 degrees. You may be sent home with medication to prevent blood clots. Remember, it is important for you to take this medication and to take it as prescribed by your orthopedic surgeon. Now, I mentioned before the importance of continuing your exercises that you learned in the hospital. You may have some pain while doing your exercises, and it is important to manage that pain so it does not stop you from doing these exercises throughout the day. You will also receive a prescription for pain medication that your orthopedic surgeon has written for you. Take this medication as directed by your surgeon. Remember, this medication usually takes about 30 minutes to take effect. So it is recommended that you take this medication about 30 minutes before you plan on doing your exercises to allow you to get the best results. You should discuss any prescription refill needs with your surgeon. Also, please notify your orthopedic surgeon if your pain medication is not controlling your pain or if your pain gets worse. You may note some swelling in your feet. Elevating your feet above your heart level for short periods throughout the day should help. Your pain should begin to lessen approximately 2 weeks after your surgery, and generally, you will begin to see a significant improvement in your pain at about 12 to 16 weeks following your surgery. Remember, there are devices available that will make things easier and safer for you during your recovery period. Whether you've had a hip or knee implant, you should use a raised toilet seat to make it easier to stand up from a sitting position. There are also other items to assist you with dressing and picking items up off the floor. You should wear shoes that are flat with closed toes to make sure you have proper support while you are exercising and walking about. You may have a decreased appetite for the first few weeks after surgery, but remember, nutrition also plays a big role in your recovery. So, you should try to eat lighter foods as they will be easier to digest. Also, try to eat lots of fruits and vegetables and drink plenty of fluids. This will help your healing process as well as help prevent any constipation that may occur from decreased activity. Your orthopedic surgeon will instruct you when you can drive. Generally, it is usually not before 6 weeks after surgery. You can discuss this with your surgeon at your first return appointment. That will usually be 3 to 6 weeks after your surgery. Your surgeon will also instruct you when you can return to work and resume normal activities. We wish you great success as you embark on this next phase of your recovery. Congratulations for all the work you've done so far while in the hospital, and we look forward to you returning to your everyday activities.